Hello and welcome again to another edition of the REBT Advocates, those therapists that advocate for a more effective therapy. Today we're going to be talking about common mistakes REBT therapists make. This is just part one. For more to follow. Let's get started. All right, so Michael, you go first. What is the biggest mistake that REBT therapists make?
Well, I think unfortunately the biggest mistake REBT therapists make is also the mistake other therapists make and most people make, and actually probably reinforces the biggest myth that people have believed through all history, and that is that events or situations create our emotions. So if I win the lottery and I'm happy, new REBT therapists or other therapists or most people will say, you are happy because you won the lottery. But that's not the way we work emotionally. It's never situations themselves that cause our emotions, but rather it's our thinking about it. And it's unfortunate when cognitive style therapists communicate that it's a situation, because it would be best if they're teaching the exact opposite. It's never the situation, but it's always your thinking. And if your emotions are disturbed, let's identify the disturbed thinking that's causing that and give you ways to change that.
So what you're saying is even the REBT therapists are beholden to cultural attitudes to our behavior, and we got to work really hard ourselves as therapists to break away from those attitudes. That's
right. And I think the attitudes are not only reinforced by our culture, but also are given to us by biological predispositions to think that way, because it seems to make sense superficially that if someone insults you and you feel hurt, that insult hurt you. So it seems like we're working against human nature also.
Absolutely. And even more, they tend to blame the external thing and not their own internal belief that caused their snapping or their rage response or whatever it is. And it's sometimes easier to blame what other people did to justify behavior instead of putting the blame on themselves and their irrational beliefs of, well, what happened to them.
Yes, exactly. I would say put the responsibility on their own thinking. They're responsible for their thinking and their emotions, not someone who treated them poorly. And if you believe that it's the insult that caused you to feel hurt, then that takes you off on a tangent trying to change the other person so they stop insulting you, rather than get to the heart of the matter, which is identifying your thinking that creates your hurt and changing that.
Wonderful. My turn. I'm going to give you what I think is the biggest mistake REBT therapist makes, because it's the mistake I used to make and still kind of do, I'll be honest with you. And that is being led by the client and just going wherever that client goes, trying to see the client, the consumer, as the one directing the session, which, that really draws out therapy to much longer than it otherwise needs to be, and curtails the expertise and the study and the training that the REBT therapist has that could really quite effectively solve the issue. Quite often, they would like to talk about their past trauma or some sort of event that happened in their adolescence that has absolutely nothing to do with the fact that they get fearful when they decide to talk in front of the group. And a lot of them are terrified about it. And really, they blame a lot of their past as the reason why they cannot get up in front and talk to people, when really it's just they're afraid of being judged by the other people, and that would be the worst thing ever, that someone says a snide remark about their presentation or speech. That's what they're really afraid of, what's happening in that moment, not that they had something awful happen to them when they were much younger.
Right. And I think a more extreme example of this is when a client starts with 1A or activating event or one situation that they're in, say their partner criticized them, and then they start telling you about that, and that reminds them of when their boss criticized them, so they'll jump to that, and then that'll remind them of that they're behind on their work and they might miss the due date, and then they start talking about that, and then they jump to some problems they had in the morning when they were trying to get up and they went back to sleep and then they jumped to another one. So they go from one A to the other. And unless you as a therapist pin them down on one A and stick to one event, and when they go off on another, say something like, well, I would like to address that too, but let's go back to the first thing you brought up and give you some closure on that. So that's the kind of thing that in my first few years as a therapist, I used to have problems with, but now I'm able to keep my eye on the target, which is what they want to talk about first, and deal with that thoroughly before I allow them to go on to something else. And when they do, immediately pull them back and remind them that if we go from one thing to another, we won't get anywhere. So let's stick to one thing. What is that? And then stick to it.
And how long do you let that go before you say, okay, we're here to talk about activating event number 1, and we're on 35 now. Let's go back to number 1. How fast do you nip that in the bud?
That's a very good question. And I think the answer is somewhat individual and contextual. Mm-hmm. In the first session, when I'm trying to learn more about the client, I'll let it go a little longer. But if I learn that the client is compulsive in this way, then I'll nip it in the bud very quickly in future sessions. Whereas if someone usually stays on track and once in a while they go off, then I'll usually let that happen.
Excellent. Thank you for your commentary on that one. Do you have another mistake that REBT therapist makes that you would like to see addressed?
Yes, and this is not a mistake therapists make in the session, but rather outside of the session. And one of the things that we emphasize to our clients is the importance of practice, repetition, reinforcement, and review in internalizing more reasonable and realistic thinking. Mm-hmm. And we often recommend the ABCDEF exercise, what I call the 3-minute exercise, where people lay out their problem, the irrational belief causing the problem, and then disputing the irrational belief and coming up with a better perspective. So normally I go through that in the session, and then I encourage them to do that many, many times throughout the week, because the more they reinforce a realistic perspective, as long as it's meaningful to them, the sooner it'll get etched into their brain. So the mistake therapists tend to make here, well, one of them, is not practicing their own 3-minute exercises on their own, because one of the best ways to improve your REBT skills is to do it on yourself. And also, as you recommend to your clients, the best way to get over some of your irrational beliefs or self-destructive behaviors is through writing out 3-minute exercises. So I've given myself a homework assignment a number of years ago to write out 2 3-minute exercises every day without fail, first thing in the morning, and that keeps my shoulds and musts at bay.
So you're actually now giving me homework to do. Obviously, I need to start doing a couple 3-minute exercises as part of my morning routine, because that will certainly help me in my practice, being able to recognize shoulds, musts, and the like when I am dealing with my own clients. So it's very excellent. I never thought to do it that quite often myself.
Yeah, that's a good point to make there, Tommy, which I didn't mention, that the more you do it on yourself, the more you get practice in identifying irrational beliefs of your own, and then you get better at identifying your client's irrational beliefs.
Excellent.
Kate, do you have another mistake that therapists make?
Sometimes when I want to confront illogical thinking and help people identify it, or even sell the ABC model to the inmate, for lack of a better way of phrasing it, they want to push back and they want to talk about things that are, well, irrelevant. And I try to remind them, hey, listen, it's, not what happens to you. It is what you believe about what happens to you. You don't just get upset, but upset yourself. And sometimes there's a bit of a power struggle. How do you prevent falling into those power struggles? I do so by just kind of practicing unconditional other acceptance with them, saying, okay, they're not there right now. I will try to phrase it in a different way. And when they're ready to change or ready to maybe reconsider this, they'll come back later. But there's some folks that would like to address their psychological or emotional disturbance through, psychotropic medication. And when I confront them and say, This is a personality issue, especially with our axis 2 disorders. There's really not much medication, if any, for personality disorders. I want to discuss the methods you can use to change your thinking to help with these emotional crises you're going through. This is the model we're going through, and they go, no, I need medication for my PTSD. I need it for my depression, and that needs some sort of chemical intervention, and not really wanting to challenge and focus on the immediate. Quite often, when I try to draw them to the immediate, they want to go the other direction.
Yeah, that's an excellent example. And what I normally do is I say, well, this is your time and you're paying me, so I'll address what you'd like me to address that's within my area of expertise. Medication is not within my area of expertise. I don't have a medical background. So if you want to take medication for your depression, let's say, and you're not interested in trying to work on it through identifying and changing your thinking, that's your choice. That's fine for you. I wouldn't recommend it, but that's fine for you. What problem would you like me to help you with? So I guess the answer is I normally avoid power struggles by giving them my perspective, but they're the boss. So the bottom is I go with them and what they want, and but I won't. If I don't agree, if they want psychoanalysis, I'll tell them what I think of psychoanalysis, but I'll also tell them that's their choice, that's their life. You do what you want. If you want my area of expertise, I'd be happy to help you there.
Excellent. You're really defining your professional identity and your professional role as not only a psychologist, which has nothing to do with medications, but more specifically an REBT therapist. And once you kind of put that out there and that's who you are, this is my role, this is what I'll be doing, it's up to them whether they want to struggle with that or not. Is that what you're saying?
Exactly. Another example closer to home for an REBT therapist might be someone who's angry. Say they're angry at being treated unfairly by their spouse, and I say, well, I can help you get over your anger, and they don't want to get over their anger. They think it's justified. So I'll say, okay, if you want to be angry, you can be angry. I'm not going to help you be more angry, but I could help you get over it. So let me know if you ever want to. What would you like me to help you with now?
Obviously, that is not the end of mistakes that REBT therapists make. I know because, well, I'm making them. Please stay tuned for the next time that we debut more mistakes REBT therapists make. Just give me some more time to make them so we can have more to talk about. In the meantime, really check out Michael's website, 3minutetherapy.com. You heard him talk about that 3-minute exercise. There you will find that and more. If you need us to address anything or have any questions, feel free to email us at rebtadvocates@gmail.com. Again, that's rebtadvocates@gmail.com. Please subscribe to the channel. We look forward to hearing from you. Bye-bye now.